AIDS. It's a word that's carried a lot of fear, stigma, and misinformation over the years. But what is AIDS really? And what should you know about it today? Let's break it down together. AIDS stands for Acquired Immunodeficiency Syndrome. It's the most advanced stage of HIV infection, HIV being the human immunodeficiency virus. When untreated, HIV slowly destroys the immune system, leaving the body unable to fight off infections or certain cancers. That's when we call it AIDS. So, what are the symptoms of AIDS? You might be surprised to know that they're not always obvious at first. AIDS usually develops after years of untreated HIV. Some common signs include chronic fatigue, just always feeling tired, rapid weight loss, frequent fevers or night sweats, and swollen lymph nodes that don't go away. Other symptoms can be persistent diarrhea, white spots or strange lesions in the mouth or on the tongue, skin rashes or bumps, shortness of breath, or a cough that just won't quit. People might get frequent infections like tuberculosis or pneumonia, and even experience memory loss, confusion, or depression. These symptoms happen because the immune system can no longer protect the body from opportunistic infections or certain cancers. But how is AIDS diagnosed? There are two main ways. First, if someone with HIV has a CD4 T-cell count below 200 cells per cubic millimeter, normal levels are 500 to 1600, that's a clear sign. Second, if they develop one or more AIDS-defining illnesses, these include diseases like tuberculosis, a type of pneumonia called PCP, Kaposi's sarcoma, invasive cervical cancer, and some serious fungal or parasitic infections. Doctors use a few different tests: HIV antibody or antigen tests, CD4 cell counts, and viral load tests, which measure how much HIV is in the blood. Now let's talk prevention. The best way to prevent AIDS is to avoid HIV infection in the first place, or to manage HIV effectively if you have it. So how do you prevent HIV transmission? Use condoms during sex and don't share needles or syringes. Get tested regularly and know your partner's HIV status. For people at high risk, there's a medication called pre-exposure prophylaxis or PrEP that can help keep HIV at bay. If you think you might have been exposed to HIV, there's also post-exposure prophylaxis or PEP, which you need to take within 72 hours. Healthcare workers follow strict safety guidelines too, like wearing gloves and disposing of needles safely. And for HIV-positive mothers, proper treatment can prevent passing the virus to their babies during pregnancy, childbirth, or breastfeeding. If you already have HIV, the key to preventing progression to AIDS is early diagnosis and sticking to your medication. This is called antiretroviral therapy, or ART. Now here's some good news. While there's no cure, HIV and AIDS can be managed as chronic conditions. ART is a combination of drugs you take for life. It suppresses the virus, helps the immune system recover, and can even reduce viral levels so low that they're undetectable, meaning you can't transmit HIV to others. That's the U equals U message: undetectable equals untransmittable. Opportunistic infections are treated with antibiotics, antifungals, or antivirals, and cancer may require its own treatment. Supportive care matters too. Good nutrition, mental health support, and a strong community can make all the difference. Let's sum it up. AIDS symptoms include things like fatigue, weight loss, infections, and skin problems. Diagnosis is based on a low CD4 count or certain illnesses. Prevention: practice safe sex, don't share needles, consider PrEP or PEP, and stick to ART if you're diagnosed. Treatment centers on lifelong ART and managing infections or complications. AIDS doesn't have to be a death sentence. With the right information, prevention, and treatment, people with HIV can live long, healthy lives. If you want more resources or a printable guide, just let me know down in the comments. And remember, knowledge is power. Take care of yourself and each other. Navigating the world of sexual health can often feel like trying to find your way through a dense fog of misinformation, half-truths, and outdated advice. When it comes to sensitive topics like HIV and oral sex, it's time to cut through that noise with clear, evidence-based information. HIV stands for Human Immunodeficiency Virus. It's a virus that specifically targets and attacks the body's immune system, going after CD4 cells, the generals of your immune system's army. HIV is transmitted through specific bodily fluids: blood, semen, vaginal fluids, and breast milk, entering the bloodstream through mucous membranes or open wounds. The simple, direct answer is that the risk of getting HIV from oral sex is very low. Medical experts consistently categorize oral sex as a low-risk activity, but low risk does not mean zero risk. The mouth's thicker tissue lining and saliva's natural enzymes provide better protection than other areas, making transmission much less likely. Certain factors can increase risk. Cuts, sores, or bleeding gums in the mouth provide direct pathways for the virus. Other STIs significantly increase transmission risk by causing inflammation. Here's the game changer. When someone with HIV takes their medication and achieves an undetectable viral load, they cannot transmit the virus. Undetectable equals untransmittable. U equals sign U. Barrier methods provide excellent protection. Use condoms for oral sex on a penis and dental dams for oral sex on a vulva or anus. These create a barrier preventing fluid exchange. PrEP, pre-exposure prophylaxis, is a daily pill that's over 99% effective at preventing HIV when taken consistently. PrEP is available within 72 hours after potential exposure. Let's bust some myths. You cannot get HIV from kissing or saliva. The virus concentration is negligible and saliva contains protective compounds. Visual inspection alone isn't reliable protection. Another myth, that HIV ends your sex life. With modern treatment achieving undetectable status, people with HIV can have completely normal, safe sexual relationships. Regular testing should be routine for every sexually active person. Knowing your status empowers you to make informed decisions and protect yourself and your partners. Open communication with partners about testing, status, and protection should be as normal as any other health conversation. Use trusted sources like the CDC for accurate information. You are in control of your sexual health. Armed with accurate information, you can make choices that align with your values and well-being while contributing to a more compassionate society. Remember, HIV is manageable, oral sex is low risk, protection works, and communication saves lives. Be smart, be safe, and be kind to yourself and your partners. Your health is your most valuable asset.